My name is Cassidy. I'll be your student nurse today. Can you verify your name and date of birth? Okay. Now wash my hands and provide privacy. On a scale of 1 to 10, what's your pain level? Okay, good. It's a 0. Today I'm going to be doing a head-to-toe assessment which tests your cranial nerves, your heart sounds, your lung sounds, your lymph nodes, your abdomen, your legs and arms, basically from head to toe, okay? First, I'm going to check the patient's body position and their nourishment, their nutritional status, if they have to use the bathroom, and overall skin integrity. Do you know where you are right now? Okay, you're in the hospital. What's today's date? Do you know about what time it is? And who is the president? Okay, he's oriented ×4. First, I'm going to do the cranial nerves. Cranial nerve number 1 is olfactory. I would take something like an alcohol swab, have them close their eyes, close one nostril, and have them smell and properly identify it. Then I would take something else like peppermint and do the other side. Cranial nerve 2 is optic. I would use the Snellen chart, stand approximately 20 feet away, and have them read the lowest line that is legible for them and test their 20/20 vision. Cranial nerve 3, 4, and 6, ocular, motor, trochlear, and abducens, is checking their pupils. Pupils are equally round, reactive to light and accommodation. So I would shine my light from the peripheral to the center and then the other side. Then I would do the H test, have them look straight and follow my finger as I draw an H. Cranial nerve 5 is trigeminal. I would get something dull and something sharp and have them point out to me where I touch them on the face with their eyes closed. Yeah. I'll do it on both sides. Cranial nerve 7 is facial nerve. I would have them close their eyes, smile, frown, raise their eyebrows, stick out their tongue. And cranial nerve 8 is acoustic. I would have them close their eyes, rub my fingers together on one side, and repeat something simple like ABC. And then I would do it to the other side, but I would say something different, like 1, 2, 3. Cranial nerve 9, 10, and 12, glossopharyngeal, vagus, and hypoglossal. I would use a tongue depressor, have them stick out their tongue and check their gag reflex. Have them stick out their tongue and move it side to side. Cranial nerve 11 is a spinal accessory, which tests resistance. I would have them shrug their shoulders against my hands and turn their face against my hands where I put some resistance. That concludes the cranial nerves. For vital signs, I would check temperature from about 98.6 to 100.3 is normal. Pulse normal is 60 to 100. Respiration normal is 12 to 20. Blood pressure normal is about 120/80. And pulse ox, you would use a pulse oximeter, but I don't have one, is 92 to 100. I would check their head, assess if there's any bumps or bruises, check for facial symmetry of their eyes, their nose is in the middle of the face, their mouth. While I'm here, I would inspect the inside of the mouth, the color of their tongue. It should be pink, their lips should be pink, and if their lips are dry or moist. I would check the lymph nodes, the tonsillar, the submandibular, submental, preauricular, postauricular, anterior cervical, and posterior cervical, and supraclavicular. Then I would listen to their carotid arteries. Listen to one side at a time. And then I would palpate one side at a time, their carotid arteries. Okay. I would also check to see if their ears are symmetrical. Next, I move to the chest. I would check the skin integrity, the temperature of their skin, the color, check the skin turgor, and then I would check for symmetry, make sure Their chest is symmetrical. It's symmetrical when they're breathing. Then I would listen to the 5 pulse sound. 5 pulses. The aortic is the second intercostal space on the right side. Pulmonic is the second intercostal space on the left side. Erb's point is third intercostal space, left side. Tricuspid is fourth intercostal space, left side. And mitral is fifth intercostal space, mid-clavicular line. And then I would do the same with the bell. I would also listen for the apical pulse about a minute while I'm here. Then I move to lungs. I would listen for their breath, ask them to breathe in and out. Listen to the side too. And then I would move to their posterior lungs. I would roll my patient over, inspect to see if there's any redness, tenderness, any pressure ulcers from laying in bed and being moist. And I would listen. And on the sides as well. Next, I would move to their arms, test their skin integrity, the temperature, if it's moist, the colors, the range of motion. If this hurts, please tell me. I would do it for both sides. And then I would test his grip, his capillary refill, and skin turgor on the top of the hand on both sides. And I would also do the skin turgor on the chest. Okay. Next, I'm going to listen to the abdomen. First, I inspect, and then I auscultate. If I don't hear anything in 1 minute, I need to stay in each quadrant for 5 minutes. Listen to the 4. I would check for redness, check the color, skin integrity, and I would percuss. And it should not be dull unless it is over an organ. Then I would lightly palpate and have them tell me if it's painful, if one side's more tender than the other. Next, I would move to the groin, keeping privacy. Assess for discharge. Here I would assess for the color, if there's discharge, if there's any tubing in place like a catheter, make sure it's in there right. I would check the femoral artery while I'm here. Then I move to the legs. I would assess the pulses. The popliteal is behind the knee. The dorsalis pedis is the top of the foot. The posterior tibialis is above the ankle. I would assess range of motion on both legs. Have them test resistance, push on my hands and pull up. And I would check the overall skin integrity of the legs, check the temperature with the back of my hand. And then I would check cap refill. Should be 1 second. Then I would get the patient out of bed if they're not dizzy or anything. And if they feel like getting out of bed, have them stand up and use the Ronberg test, walk to the door and walk back, and then test their balance. Have them stand in one place with their eyes shut, and if they start to sway within 20 seconds, get them back in bed before they fall. I used proper documentation and communicated well with my client, and that's the end of my skills test.